right, my name is Jennifer, and this is my informative speech. This is part of what I've been using for my joint replacement class. So I'd like to welcome you, patients, for coming to the education class for your joint replacement. We're going to address the pain aspect. Your pain is expected. You're going to have pain. It's going to hurt for a while. I've had patients wake up and say that, that they hurt, but it's a different type of pain. So hopefully, if you've been suffering for years with this problem, hopefully when you wake up, it'll be a different type of pain, and this type of pain will go away, get better each day. So there are complications to not controlling your pain. If you don't control pain, you don't want to move. So then you have a longer rehabilitation time. You're more at risk for pneumonia. You're more at risk for blood clots. Blood clots can travel. They can go to your brain, your heart, your lungs. They can stay in your legs, which are all are serious complications. And we start this with teaching. Teaching is one of the biggest issues in one of the biggest answers to controlling pain. So the staff, the nurses that will be working with you, they've been educated. This is part of the patients being educated. So how are we going to control your pain? Your doctors, during surgery, they use this cocktail that they call it. It's like 3 to 4 different types of medicine, and it's injected into your joint. So you have a little bit longer acting pain control. A lot of patients don't start feeling pain until that starts to wear off, and usually that's about 10 to 12 hours. The night of surgery, we'll start with an anti-inflammatory medicine that can be by mouth or through your IV. We try not to use IV medications anymore just because it can be so sedating and it doesn't last long. So you'll be getting Tylenol every 6 hours, and that's to help with pain. You'll also have access to your short-acting pain medicine, which you can get every 3 to 4 hours. So you'll have a board in your room, and it's got the scale. The scale is 0 to 10. 0 is nothing. 10 is the worst you could ever imagine. Say a shark bit your leg off while you were swimming. That's what you should imagine a 10 to be. We never want you to get over a 5 because it's harder to bring your pain back under control once it's out of control. So ask for your medicine. Your nurses will offer it, and your night shift nurses will almost insist that they give it to you before they leave between 6 and 7, because therapy will come usually somewhere between 9 and 11. Of course, they have to see everybody, so they have to go down the list. You'll have ice packs. You'll wake up from surgery and you'll have an ice pack. You have a freezer in your room. There'll be 2 little gel packs that fit in this cloth package, and you'll have 2 in the freezer and 2 on you almost all the time that you're in the hospital. Make sure you take it home with you. Use it before therapy. Use it after therapy. And hopefully you'll be on a way to a speedy, healthy recovery. The goal of pain management is not to take away it all, but to get you to where you can tolerate your therapy and all your activities that you need to do, go to the bathroom, start getting out, and be able to tolerate your therapy. So hopefully this has answered any questions or alleviated any concerns about pain management. It's all very individualized to what you're allergic to and what you can tolerate. There's medicines for nausea. If you eat a cracker when you take the pain medicine, sometimes that helps with not getting nauseous. So thank you for your time, and hope you have a speedy recovery, and I'll see you soon. Thank you. How long was that?
Like 4.5 minutes.
I keep on trying to hit it, but it doesn't work.